Between Dr. Seethamrajan and myself, we've calculated that we've probably cared for over 1,000 lung transplant patients in our careers. Therefore, we've seen quite a lot, and that allows us to sort of build on that experience in caring for these critically ill patients.
We are able to moderate the risk on each patient in a way that other centers may not be willing to. We keenly evaluate every potential donor, otherwise passed by many centers, and look closer, deeper, even in the middle of night, and see if it's acceptable and optimize the risk on our recipient. A lot of patients that we have transplanted here were probably deemed not good candidates or not appropriate candidates for transplant, and we find a way for them. And those patients have excellent outcomes.
Bloodless cardiothoracic surgery has been a clinical interest of mine since I was a resident. One of my mentors instilled that in me. The ability to perform bloodless transplants really optimize the recovery for all of our transplant patients, including the most complex ones, including multi-organ transplants.
We often invite a patient or few patients to interact with the patients who are coming into transplant or who have had transplant and share their experiences. And that creates an environment for them to ask freely questions from their other patients, how their journey was. And that's usually very helpful for both the patient and their families to go through this process.
We would expect 90% of patients to be alive at 1 year following lung transplantation. At 3 years, it's about 75%. The only real limitations patients have after lung transplantation, after any transplantation for that matter, is that they're on quite a few medications. We've had patients go on to compete in triathlons. We've had patients skydive. So really, there's no limitations once they're over the actual surgery part. One thing that's been clear to me in my several years that I've been here is that administration is very supportive of all transplant endeavors at Mount Sinai and will continue to be so. At Mount Sinai, we find a way.